Today's the day I move up to 12.5 milligrams of Mounjaro, and I can't lie, I'm nervous. In case you didn't know, I was on 10 milligram for 16 weeks. On Mounjaro, I like to feel hungry enough for breakfast, lunch and dinner, but in control enough that I make wise, healthy food choices. 10 milligram worked really well for, like I said, 16 weeks. But I have started noticing these past couple of weeks that I'm feeling more hungry in between meals, and I've still got a long way to go on my weight journey, so I want to try and control that narrative for a little while yet. So let's prime my pen. If you're new to a GLP-1 medication, I would always recommend to read the patient information leaflet inside out before starting on your medication. If you've got any questions or you're not sure, maybe some of us who have been on it for a long time, a little bit more experience might be able to help you. If not, your prescriber definitely will be able to help you. 12.5. First up, I'm going to prime the needle. So you pop it on. Some twist and push on, some depends on the needle this end. Keep your big cap because you're going to need that to take your needle off. Only a small thin needle, it doesn't hurt at all. Your pen will go from 0 to 1. That means 1 dose. Mounjaro pens are all the same no matter the strength, 0 to 1. But to prime it, I'm just going to do a couple of twists and press. Okay, so it is normal the first time you're using a pen to have to prime it a couple of times before it works. There we go, that's shot out. I'm good to go. So I'm going to wind it back up to 1. I always inject into my tummy, and I do alternate size and different areas week to week. You can also inject into the top of your thigh and the back of your upper arm. So all I'm going to do is insert that into my stomach, press this purple dial until it goes back to 0, and then I hold for at least 6 seconds. Usually I do it for 10. That's just to ensure that all the medication has dispensed out of the pen and gone into that subcutaneous skin and fat. I also hold the pen quite firm against my tummy, and that cuts down on bruising, because sometimes little blood vessels can you can nick them, and they can leak slightly, and that can cause very mild bruising. Because I'm talking to you, I forgot I was nervous. Yeah, usually if you just press nice and firmly, that cuts down on the bruising. And after 10 seconds, I just withdraw. And that's the pen after 1 week injection. Get my lid, and I just twist and pull that off. That will go in my sharps box. I'm going to keep my pen out at room temperature. You can also keep it in the fridge. It does need to be used within 28 to 30 days. I'm not too sure which one once opened. You will also have an expiry date on the side of your pen. Always ensure that your medication is in date, because it is unsafe to use if it's not. So let's see how I get on with 12.5 milligrams. I will keep you updated, but if you've got any questions, please drop them in the comments and I'll get back to you ASAP. And in case you didn't know, I'm only trying to maintain my weight at the moment because I'm in recovery with a fractured leg. And I'm struggling with my recovery. Therefore, I'm just concentrating on maintaining. If I lose, that's great. If I don't, it's not the end of the world until I start to feel better.